This is just going to be a quick in service on identifying your patient's needs during their admissions. We want everybody to try and be a patient advocate. So this is just going to go over just a few things that you already know about, but we're going to go over some scenarios too, because of what CMS is also doing as far as payment-wise. Because you know that CMS, Center for Medicare and Medicaid, they are assessing penalties for readmissions within 30 days. For instance, there was one statement that came in with the paperwork from CMS that patient goes home and they end up falling at home and have to return. Well, then we didn't educate them well enough, and we didn't identify that need while they was in the hospital, that there was a risk for falls. So they're going to penalize us for that readmission because we should have addressed that while they were here.
Not fair.
No, it is not fair. Yeah, and of course we are not mind readers. We can't see into the future, but we're going to try and see as much as we can during the admission process to help identify that. This here is just a little bit of information on as far as the readmission tracking, and this has just been since February. I was out for this is for St. Mary's. St. Mary's is 20.93% for CHF readmissions within 30 days. The regional goal is 14.4%. But I have to give kudos to Highland. Y'all are at 6.41%.
That's what it's supposed to be. That's what it's supposed to be.
6.41%. Now this is February's statistics. These are February's data. So I haven't gotten March yet either, but I don't think you could rise to. Hopefully you hadn't gone to the 20.93% that St. Mary's is at. So. But we're going to get on into it. We're going to go through a couple scenarios of what a patient comes in. So this is not anything extra, any extra paperwork. It's all you can do during the time you go in there when that patient is admitted here into the hospital and they come to your floor. Okay, Mrs. Jones is 54 years old with a new diagnosis of congestive heart failure. Her primary caregiver is her daughter, who works full-time, but her daughter does manage to see her at least 4 times a week. Mrs. Jones lives alone, and she uses a quad cane to ambulate. Her only significant history is gout and high cholesterol. What discharge assistance will she need? Just from viewing that, what's the first thing that jumps out at you about Mrs. Jones?
She's teaching for the congestive heart failure.
Teaching for the congestive heart failure. This is a new diagnosis. So now we know with a new diagnosis, especially with congestive heart failure, we know there are some things that she is definitely going to need while she's here. So we can go ahead and get that process started. So what would be one of the things that we need to make sure we go ahead and get started now?
Home health.
Yeah,
home health
for meds.
Definitely. Because one of the major things, education, and their food. So we're going to have to get that dietitian in here, you know. So, and another thing, what else jumps out at you about Ms. Jones?
Physical therapy.
Yes, physical therapy. She walks with that quad cane, but is that the right thing for her to do? Maybe she needs a walker. So we can get physical therapy in here on her, you know. When she's getting up to go on weight, you can assess that mobility there, because evidently she can walk. She uses a quad cane. So just see how it is when she transfers maybe from the wheelchair to the bed, or getting from the bed to stand up to the standing scale. Assess her mobility and her gait then. So we see now that home health, definitely. We're going to talk home health up. We're going to discuss, hey, they're going to have a nurse available to you 24 hours a day. They can get in touch with a doctor for you and everything. We're going to pump up home health for her. The next thing is physical therapy, like you say. She may need a quad cane. She may need some more, and maybe the quad cane is enough. But we need to make sure that when she leaves here, that that's going to be enough for her. Okay? Because now she's going to be on medications that could possibly drop her blood pressure, that can make her dizzy. So we need to make sure that there's not a potential of falling in relation to her new diagnosis and her gait.
Who got 206?
Dietitian. Okay? New diagnosis of congestive heart failure. So definitely, she needs to know that there's going to be a lifestyle change in the way she eats, if she's not used to it already. Now, possibly occupational therapy, and the reason I put that in here is because, with congestive heart failure, they do get tired and short of breath. So, an occupational therapist can help her out with her ADLs.
Yeah.
Okay? Help her do those things that she normally does without exerting so much energy. Okay? Is she able to obtain her medication?
Amen.
She's going to be on some new medicines now, different from what she's been taking. Will she be able to get those medications? It's fine while she's here, but when she goes home, we need to make sure that we keep that up. So ask her, Ms. Jones, will you be able to get this new medicine that you're on? If she says, well, I may have problems, call the social worker. The social worker can find resources to help Ms. Jones out. Right? And then let's utilize that Project Red Nurse. Doing your admission, you're getting in there. Of course, you're going to top off these things here, get it started here, try to get all those worked in for you. But that Project Red Nurse can stay in there a lot longer than you can. So she can go over a lot more. But we at least need to get the ball rolling. We don't want it to get it somewhere and stop and that ball deflates. We need to keep it inflated and keep it rolling. So let's make sure that Project Red Nurse is in there, following up behind us, doing what we have to do.
Well before discharge, so she has several days to teach her.
Discharge, definitely. But CHFs don't stand here as long as they used to now. They definitely do not. So that's why we need to get this started right at the beginning. All right, let's go to scenario 2. Mr. Robinson is 68 years old with chronic COPD. You notice during your admission he ambulates with some difficulty. He lives with his daughter, but he continues to drive. His daughter is in the room with you and states that she will work with you to help get the needs that her father needs, everything that her father needs, help you with that. His medical history consists of diabetes, which he does not own a glucometer, hypertension, and GERD. So what discharge needs are appropriate for Mr. Robinson?
Home health.
Home health.
Home health. Now, I put a question mark because he continues to drive. Now, people think, well, he's driving, so he doesn't qualify. That's not necessarily true.
He can get a couple of visits.
He can get a couple of visits in to get him stabilized. And his daughter's already said, hey, whatever you all need me to do, I'm going to help you out with this. So we definitely need to get him some home health in there. And he may just be driving to his doctor's appointment. That's maybe his little independence that they give. And that still does not disqualify him for home health, because he can drive himself too.
Since when did that start?
What they've been teaching them? That's what, when I was in home health, that's
They
what
said that if they only drive to the beauty shop, doctor's office, and come right back, they don't do any grocery shopping, that kind of going out, that type of stuff, then they do qualify now for home
The
health.
only reason why I said it because when my dad was sick, that was the number one thing they told him: if you drive at all, you will not qualify.
You can.
That?
You
That's
do.
exactly
It has
what they
to be
said.
a taxing effort.
Right.
Yeah.
Right. It can't be that he just, let me get up and go and run out there and get his car and drive.
I'm just saying, so he could not drive. Everybody had to drive him everywhere he wanted to go for him to qualify.
It could have been something
They
that have
misinformed.
occurred within their system that they have gotten real strict on their end about.
Yeah, maybe it was the
driving.
particular company he was with.
Right.
But we have
Crystal
several
Shaw.
papers. Oh, really? Because they're the ones that told us.
Right.
Yeah, and that could have changed recently,
Right.
especially now that this is new. This new changes with the government, and so with them wanting us to have a certain amount of people at least
And let's real
put on the
Right.
temporary home
Right.
health and that
So
type
they
of
could
thing.
have loosened the belt,
Loosen
so
the
to
belt,
speak.
yeah.
Contractions are every 2 to 3 minutes.
Oh my
Oh,
God.
wow.
Oh God, don't let her have that baby. Okay.
All right, so yeah, definitely home health. What's another thing?
We need to get him a machine. And
Definitely.
Diabetic nurse.
Yeah, diabetic nurse.
We need
yeah.
to get that diabetes education.
'Cause obviously
because
he ain't checking
He
it.
has not been checking his blood sugar,
Just
so he
takes
doesn't know what has been running. Don't know what's been going on with him. So we need to find that out. Also,
He's
he's
occupational therapy, wasn't he?
occupational therapy, definitely, because with
Yes.
COPD, they use a lot of energy. That just having the diagnosis, the disease process alone requires exertion, and that requires energy, and they get tired a lot easier. So definitely occupational therapy in with him.
And physical therapy
And
too,
physical
because he got
therapy,
this difficulty
especially with that
walking.
difficulty
And you add
in
that
the-
shortness of breath with it, he gonna fall.
Right. But we also kind of got a double whammy with Mr. Robinson here. Because if you notice, he has a history of diabetes, hypertension, and COPD. So he needs the extra calories for his COPD. He needs the low carbohydrates for his diabetes. And he needs the low salt and fat for his hypertension. So there's no telling what he's been eating, how he's been eating, what his blood sugar has been, because I'm quite sure he's not eating appropriately to accommodate all these chronic diagnoses that he has. So we definitely need to get dietary in there with him. You get that Project Red Nurse in there with him. You know, first I say, hey, Mr. Jones, what do you know about your COPD? What do you know about your hypertension? What foods do you like? So we're doing that process time when you're doing your admissions, when you find out the foods he likes and doesn't like, that you kind of slip that in there. But do you eat a lot of salt? You know, do you eat a lot of potatoes and French fries and things like that? So we can find out what's going on with him. So definitely occupational therapy to help cut down some of that energy he's using to do his everyday activities. Oh. Physical therapy, definitely. Now put home health out the side because, you know, most home healths now have these interdisciplinaries within the company. So we can start it here and they can continue it on when he gets home. Dietary, definitely. Let's get dietary in there to help him out with that. Diabetes education. And along with that glucometer. So we find out from the beginning that, hey, he doesn't have a glucometer. Let's tell the doctor right then and there, leave a note. Mr. Robinson does not have a glucometer. Could you write him a prescription for his glucometer strips and lancets before he goes home? And is he able to obtain his medication? If he doesn't have a glucometer, 9 times out of 10, he's probably not taking his medicines either the way they're supposed to have. Oh, I just didn't get it filled. You know, well, why? Are you able to get your medicines? All right, scenario number 3. This looks like it may be a little. This is Miss Adams. She is a 31-year-old with a new diagnosis of CHF. She states that her shortness of breath got worse, so she decided to seek help. She is married with 1 child. She has no significant history, and she does not have a primary care physician. She has private insurance, but at the present, Miss Adams is not working. So what discharge needs can Miss Adams benefit from?
31?
31. You would be surprised.
She needs a primary physician like yesterday.
Yes, exactly. A young person, who knows, this could be acute or chronic CHF. Who knows how long she has been having this shortness of breath. She probably just been putting it out because she has a 1-year-old child thinking, oh, I'm just tired from running and taking care of my 1-year-old child. So she could have been putting it off for a while. So she definitely, as a matter of fact, I have been seeing younger and younger over at St. Mary's patients with new CHF. 24 years old, 28-year-old, yeah, younger and younger. What exactly going on? I'm not sure, but they are coming in younger and younger for this diagnosis. So we definitely need to get Mrs. Adams a primary care physician. There are cards that you can give them that is a 1-800-DOCS. And they're purple cards, and just say, you know, just emphasize, educate her on this. You have a new diagnosis. You're going to be on some medicine. It is, you know, of the utmost importance that you get you a primary care physician because there may be adjustments in your medications. You need to make sure that you are monitored on a regular basis to keep this diagnosis from getting away from you. Break it down to her, put it in her terms. You know, let her know that it's a serious but manageable diagnosis. Also, possibly home health. The reason I say because she's 31 years old, I'm quite sure she is out, she's driving, she's got a 1-year-old child, you know, she's not working at the moment, you know, she is married, so there's things that she's doing.
She might get 1 or 2 visits, though.
Exactly. We might, you know, if you tell her the seriousness of her diagnosis, tell her what all it entails, and let her know, hey, to get you started, to help you get over that hump, let us get home health in there to help you out first, to show you and get you in the routine of doing these daily things so it becomes a habit with you. And if they won't stay in there permanently, that they're there to get you over that hump. A dietitian, definitely. Because she's got a lifestyle change that's coming up. 31 years old, she's probably eating fast food, running through there. Oh, my child wants me some French fries, so while I'm there, I'm going to pick me up a hamburger and some fries too.
Well,
yeah. So that drive, yeah. Since I'm here, no need me going nowhere.
I ain't gonna have to cook.
Hey there. All right.